Dr. Stacy Spizuoco, I think you've all met her. She's been a guest panelist here before. She's a graduate of NYU College of Dentistry. She completed a one-year AEGD. She's also a clinical instructor at Columbia University College of Dental Medicine, and she's in private practice in Manhattan with a special interest in providing aesthetic dental solutions. Her topic today is using cosmetic dentistry to enhance facial aesthetics. I've seen the presentation. You are really going to enjoy this. Welcome, Stacy. Thanks so much for joining us today.
My topic today is talking about using cosmetic dentistry to enhance facial aesthetics. Now, normally when we think about facial aesthetics, we think about going to a dermatologist or a plastic surgeon or someone like that and getting a facelift or filler or Botox or something like that. I want to talk about how as dentists, we can also enhance the facial aesthetics. So when we think about cosmetic dentistry, we think about veneers and bonding and crowns and stuff like that. And I also hope we also think about orthodontics, and I'll talk about that a little bit later. With cosmetic dentistry, we can enhance the structure of the mouth, we can enhance the smile arc, we can correct a cant, we can enhance the buccal corridors, expand them, and we can also enhance lip competency and the lip profile. With facial aesthetics, we want to talk about lip contour, the fullness of the lips, the symmetry. I'm sorry, can you hear me? I just heard something. Okay, competency. We also talk about, we can also enhance the maxillary protrusion or mandibular protrusion. And also when we move around the teeth and the jaw bones, we enhance the facial height. Someone's not on mute and I keep hearing a background noise. Sorry, it's distracting. So we think about braces, we think about orthodontics, not very aesthetic, cosmetic. So we're fortunate in my lifetime, at least, to have the invention of clear aligners, which is very aesthetic. And specifically, I like to use Invisalign. Oh, I'm not playing. Mo, I'm not playing now. I can't go forward. Okay, so this is what traditional braces look like. And you can see how they've tried to pretty them up by some pink elastics, still to me, not too cosmetic. And then now here's clear aligners, Invisalign. So what I wanted to also talk about is the shape of the arch. And so a lot of patients come in and they're concerned because their front teeth are sticking out. They weren't always like that. They're not straight anymore. They're buck teeth. And so you want to look at their arch. And now the one on the left is the most common, I'm sorry, the ideal, the U-shaped arch. And what we see commonly, the last three, is a V shape, a square shape, and then the omega. What you notice here is the premolars have kind of moved in lingually and pushing the front teeth out. But of course, the patients don't see the structure of the premolars that moved in lingually. They just see their front teeth sticking out. And then there's some bite types here, and you can kind of imagine how you have the normal edge-to-edge deep bite, anterior open bite, the deep bite. You can kind of imagine how, because the maxilla is leaning down, is pushing more down, that the lower lip is kind of being covered by the upper lip, and we'll get to something like that. Also want to talk about these class types. The ideal, obviously the class 1, we see a class 2 and a class 3. And you can again imagine how with like a class 2, the maxillary lip is kind of protruding out and the mandibular lip is being hidden. And the same thing with like a class 3, you can imagine like the lower lip is kind of more protrusive. So these are things that we want to correct. And here's a nice slide showing how this patient presented with the class 2 and the upper lip is protruding more than the lower lip. And then when we see after orthodontics and we straightened out and corrected the bite to a class 1, the patient now has a nice even lip protrusion. The maxilla and the mandibular upper and lower lips are lined up. So I want to start talking about this first patient that presented to me. This girl, she came to me right before COVID, and she was concerned that her upper front teeth were sticking out and they got crooked, and especially that canine, the number 11. And so what she didn't realize was, again, now the premolars are kind of moved in lingual. She kind of has an omega kind of shape there. And with aligners, we were able to expand those premolars buccal, expand the buccal corridor, and straighten out her teeth. And we did this, we started COVID at the beginning of COVID, and we went through, and she was a great patient. We were able to FaceTime, and she sent me pictures, and I sent her aligners to wherever she was quarantining. And we can see here that we were able, by just expanding that upper arch a little bit and bringing those teeth in, we were able to give her more of a lip competency. You can see her profile here. The upper lip is even now with the lower lip, and it has like a nice arc to it. And here as well, you can see that her smile has expanded. It's more horizontal, it's expanded more horizontally, and her upper lip is even fuller. This next patient came to me because he hated when he smiles and you can't see his upper front tooth. And I noticed that too, the number 7. Can also see number 10 is moving more incisal, gingival than it should be. So we put him in Invisalign. He was about, I want to say 13 months. This was a long time ago. This was before the 1-week switch. So he wore his aligners for 2 weeks. And you can see how we corrected his crossbite there, the 7 and the 27, and we brought them more incisal, the same thing with the 10. What I love about this now is look at his smile. At the beginning, his right upper lip was kind of curling up a little bit when he smiled because of that number 7. And now, because the 7 and the 10, everything came down, that muscle has relaxed and his smile is just very, very even now. Very nice result. This patient came to me back right before COVID as well. We started her, and she said to me, she just spent time with her sister, who's a couple years older than her, and she noticed her face is getting sunken in. And she looked at her teeth and she saw her teeth were being sunken in. And she doesn't want that to happen to her. She doesn't want to go to her dermatologist and get fillers. She wants to fix her teeth because she thinks that's how it's going to fix it. And I was thinking, are you inside my brain? How did she come up with these ideas? But it was great. So we started her right before COVID. Again, we went through COVID with her. You can see also her premolars are kind of inclined lingually, and on her left side, those premolars are even more incisal than they should be. It almost looks like that part of her jaw kind of collapsed in. So she wore her Invisalign all through COVID. I sent them to every single home she had. She was in Wyoming, she was in New York, she was in Florida quarantining, and she wore them. We did one refinement, I think, on that lower lateral, the 23. Didn't want to move into place, but it did. Now we put her in Vivera, and you can see here how on her first picture, the right side of her cheek was more square and the left was kind of straighter. Now we've got her completely even. Both sides the structure is enhanced, and she seems more, her lips even seem fuller. So this was a really nice case. This next patient was my hygienist who just complained that her teeth relapsed after braces. She didn't like the way they were collapsing on the sides. We put her in Invisalign, and everything came out really straight. You can see on her left side, she's in occlusion now. And the final was we were also able to enhance her lips as well. She's got more of a horizontal smile. Her upper lip looks fuller. And I guess she was so pleased with the treatment, she even decided to do her eyebrows. Nothing to do with that, but I think they came out really nice. This last patient was really fun. She came into me and she said that she hates her rabbit teeth. She has buck teeth, her rabbit teeth. She can't stand them. And it does look like that. But then when I looked at her closer, I saw that, see the 7 is a peg lateral. It's leaning lingual. The 10 is a peg lateral. When I looked at her closer, I saw that it's not her front teeth that are sticking out. It's the 7 and the 10 that just didn't develop properly. And I think she has a really nice smile arch here. Like if you follow the cusps, the arch is very ideal. I didn't really want to move too much with Invisalign or anything. So I decided to make her my own aligners. And what I did was I took her impression and I poured the model. And then I cut the teeth off, the 7 and the 10, and I positioned them more buccally the way that I wanted them. But in small steps, I made her about 4 or 5 aligners. So I moved them slowly and, use my vacuform machine, and I would put the model under and do my suck down and make her an Esthetics. I use 0.4. I like that material. Here it is before I give it to her. So she would come in, she would wear it for about a week, and she would come in a week for me to check her. And if they didn't move enough, I would make her another aligner, take an impression. But in the meanwhile, I would dimple her aligner. And I don't know if you guys know about this nice little tool from Invisalign. It's a dimpler. You see that little prong there. What you do is you push it into the aligner and you make a little dimple or a little like push, like a little button, and it will help to push the tooth and move the tooth as well while she was waiting for like her new aligner. Or you can even do this at the end of Invisalign when a patient everything is perfect except one little tooth needs to rotate like a hair. can just try that. So this is what we got her to, and about 4 or 5 of them. We were able to move the 7 buccal, and now it's an occlusion, fix that crossbite there. And the 10 a little bit, it's just that 10 was just a difficult tooth. It just didn't develop properly. So here's from her right side and her left side. So the 7 looks good, but she still had spaces. It's still a peg lateral. So what we wanted to do next is now make her some veneers. So I wanted to use some minimal to no prep. So I went with Glidewell's veneers. I used lithium silicate because I thought that was a really nice material, very aesthetic. And we bleached her and we got her to like a B1. And I prepped the teeth a little bit. I took off the old bonding that was on that number 10, and I prepped the 7 just a little bit on the incisal so I can get some clearance, and a little bit on the buccal in that middle third because it was really, the emergence profile was really protrusive. And this is what I did. I scanned her. We sent it to Glidewell. This is me with my scanner because I was so happy when I first got it. And then Glidewell sends you back this nice printout along with the veneers, this nice printout of their scan and how they do things. It's really neat. And this is us getting ready to cement them in. And this is what we did. This is what they came out like, which I think is a fantastic result. I mean, all her teeth look perfectly straight. We have her side views here. And this is the before when we started her in the very, very beginning. Those teeth were very lingual and in crossbite. And now the final. And this is her new smile. So this is her smiling before. This is her after with the veneers. You can see how her upper lip is so much fuller. To me, this is like the best result. And this is the before again and the after, much fuller lips, broader smile, wider smile. And her profile, she actually has like an upper lip now. Before it was just straight. And now she's got that little smile arc and that little curve to it. And just could not be happier. She just is the happiest person. And just moving those 2 teeth, we're able to move her teeth and correct her smile, and we're able to correct her facial aesthetics. So I think this was a really, really good result. And I also wanted to bring up what Dr. Romano was saying and Dr. Levin, how patients are coming back and they're more accepting treatment. And it's because, maybe because they just are finally looking at their mouth more and taking care of their oral health. It took like a pandemic to get us there. They're watching themselves on Zoom all day long, and that one little tooth that was bothering them now is driving them crazy and they want to fix it. So I find my patients that when they came back are more accepting the treatment, and they almost shocked me about it, how they brought it up and said, "Doc, I'm ready to do that Invisalign." And I thought, well, we spoke about that so many times. Okay, let's do it. And I think Dr. Levin had also brought up last time about how patients maybe have a little bit of extra money. And I don't want to be insensitive. I know a lot of patients did lose their jobs, but some didn't. And they might have a little bit of extra money. They were saving for a big trip or something like that. And now they didn't go. So they have that extra money and they want to focus on their oral health, which benefits us. So I think we're in an auspicious time right now with patients. And then hopefully we can present these treatments to them, and hopefully we can even present to them that we can improve their facial aesthetics. You know, their lip is incompetent, or their symmetry and stuff like that. And hopefully this will be a good thing for all of us now. We're in a great place, I think. And these are just another thought about teeth. My Glidewell leader girls, my family sent me these when I told them I was going to do a presentation like this a while ago, Dr. Sadi and Dr. Poskazim. And it makes sense, you know, you're never fully dressed without a smile. And that's what I wanted to say about that. If anybody has any questions.